Hi, hello everyone. Dr. Ravichandra official. Today we will discuss the cytology. Cytology means study of cells and it is related to anatomical pathology. While histology uses the tissue sectioning techniques, cytology uses various cell preparation technologies. Cytology diagnosing the diseases by looking at single cells and small cluster of cells is cytology or cytopathology. Cytological specimens are easier to get, causes less discomfort to the patient, less likely to cause complications, and cost is also very less. Types of cytology: it can be diagnostic or screening. Cytology allows the diagnosis of malignancy from a small number of cells. Cytology is a discipline that involves the morphological study of cells. It is broadly divided into exfoliative cytology and aspiration cytology. Exfoliative cytology involves the examination of specimens that contain cells exfoliated from the body cavities and surface. They are further subdivided into pap or cervical smears under gynecological cytology and pleural fluids, peritoneal fluids, cerebrospinal fluids, urine, sputum, brushings, etc. under non-gynecological cytology. Coming to aspiration cytology. Aspiration cytology involves the examination of cells that are actively obtained by fine needle aspiration. Cytology provides a minimally or non-invasive means of obtaining the samples and allows the analysis of specimens such as exfoliated cells in sputum and urine and pleural, pericardial, cysts and also in ascitic fluids. Fine needle aspiration yields cell samples from palpable lesions and under image guidance from inaccessible sites such as mediastinum, lung, head of the pancreas and para-aortic lymph nodes. As with many tests, appropriate clinical information and patient's history are very essential and enable the directed ancillary testing of limited material. Specimens are obtained mechanically by scrapings or needle aspirates or by collection of exfoliated material from various body fluids. Specimens analyzed are urine, sputum and other body fluids, gynecological pap smears, sputum cytology, urine cytology, other specimens for cytology, pleural, pericardial and ascitic fluids, synovial fluid, cerebrospinal fluid, fine needle aspiration and cell blocks. Specimen collection under gynecological cytology. Conventional. Label a clean glass slide with patient's name and IC number with pencil on the frosted end. Do not use lubricant on the speculum. Place cervical spatula at the external os and rotate through 360 degrees, lightly scraping the squamo-columnar junction. Smear the material onto the labeled glass slide about as thick as a blood filling. Fix the slide immediately, either by immersing it in a poplin jar containing 95% alcohol for at least 30 minutes or use a spray fixative. Air dry the fixed slide. Place the slides in a slide mailer and dispatch to the cytology laboratory. Fluid-based cytology. Label the vial with patient's name and IC number. Do not use lubricant on the speculum. Obtain an adequate sample from the cervix using a broom-like device. Insert the central bristles of the broom into the endocervical canal deep enough to allow the shorter bristles to fully contact the ectocervix. Push gently and rotate the broom in a clockwise direction 5 times. Rinse the broom into the vial containing the fixative solution by pushing the broom into the bottom of the vial 10 times, forcing the bristles apart. As a final step, swirl the broom vigorously to further release the material. Discard the collection device, tighten the cap and send the vial to the cytology laboratory. This is also called as liquid-based cytology technique. Totem examination. Specimens must be collected on 3 consecutive days. Instruct the patient to empty the mouth of all saliva immediately after he wakes up in the morning. The patient should then cough deeply and collect the resulting sputum in the container supplied. The specimen must be sent immediately to the cytology laboratory. Do not forget to collect a similar specimen on the next 3 days. The specimen container should be labeled according to the day the specimen is collected. For sputum specimen submitted as smears, label to clean glass slides for each patient with name and IC number. Prepare the smears as thick as blood film and immediately place the slides in 95% alcohol for at least 30 minutes or use spray fixative. Air dry the smears. Ensure the slides are not placed face to face in the slide mailer. Urine examination or urine cytology. The patient should void and discard the first morning urine specimen. Collect the next voided urine and send immediately to the cytology laboratory. Body fluids: pleural fluid, peritoneal fluid, pericardial fluid, cerebrospinal fluid, and synovial fluid. Specimens are collected in clean containers and dispatched immediately to the cytology laboratory. Bronchial brushings or CBD brushing. Label 1 to 3 clean glass slides with patient's name and IC number. Smear the material about as thick as a blood film. Immediately place the slides in 95% alcohol for at least 30 minutes or use spray fixative. Air dry the smears. If more than one slide is to be placed in the same slide mailer, ensure that they are not placed face to face. Fine needle aspiration uses a very thin hollow needle attached to a syringe to take out a small amount of fluid and very small pieces of tissue from the tumor. The doctor can aim the needle while feeling the tumor if it's near the surface of the body. If the tumor is deeper inside the body and can't be felt, the needle can be guided while being watched on an imaging test such as an ultrasound or CT. The main advantage of FNA are that the skin does not have to be cut, and in some cases it's possible to make a diagnosis the same day. But the disadvantage is that sometimes this needle can't remove enough tissue for a definitive diagnosis. Fine needle aspiration cytology or FNAC. It is a technique whereby cells are obtained from a lesion using a thin bore needle and smears are made for cytopathological diagnosis. Two methods of fixation and staining are used in FNAC. First one, air drying followed by staining with a hematological staining such as MGG stain, Jenner Gemsa stain or Diff Quick stain. Second one, alcohol fixation and staining with hematoxylin and eosin or PAP stain. It is a safe minor surgical procedure and it can be carried out as a blind procedure usually for superficial lesions and for deep-seated lesions under radiological guidance like ultrasound, CT guided, etc. This technique is based on the fact that the tumor cells are less cohesive and are easily aspirated. It is used in the diagnosis of breast lumps, lymph nodes, thyroid nodules, liver disease, subcutaneous soft tissue masses, salivary gland diseases, and also oral diseases. Advantages with FNAC. It is fast, early diagnosis can be made, less pain, less trauma, no anesthesia is needed, acceptable by patients and doctors, it is very accurate. Complications: needles trauma, granulation tissue formation, granuloma formation, sarcoma-like changes, needles, standard disposable 27 gauge or 22 gauge, 30 to 50 mm long needles are suitable. Patient information and patient preparation. History and examination, consent, disinfection of the patient. Biopsy procedure. Palpate and fix the swelling. Insert needle with syringe into the target tissue. Plug is pulled to create a negative pressure. Needle is moved back and forth. Negative pressure is released when needle is within the target tissue. Needle withdrawn and the needle is detached from the syringe and air drawn into the syringe. Needle is reattached and sample blown onto microscopy slides, smeared and fixed. Fixation. Slides may be air dried or wet fixed. Air dried for toluidine blue staining or AFB staining. Wet fixed in 70 to 90% alcohol for HND staining and PAP staining. HND staining or hematoxylin and eosin staining. First, hydrate with graded alcohols. 100% alcohol 2 dips, 70% alcohol 2 dips, 50% alcohol 2 dips, then water wash. Staining. Hematoxylin for 5 minutes. Then differentiation with 1% acid alcohol, only 1 dip. Bluing of the smear. 0.2% ammonia or running tap water for 10 minutes. Counter stain with eosin for 1 minute. Then dehydration through graders of alcohols. 70% alcohol 2 dips, 100% alcohol 2 dips. Cleared in xylene 2 dips. Thank you for the patient listening. Do subscribe and press bell icon if you found the video helpful and show your support. Dr. Ravichandra Official.